Todi sir, our last question is something which a practical tips for all the institutions. Suppose an hospital, a new hospital, or somebody who is interested in starting a research cell, a research wing, and could you briefly describe is it advantages or what are the tips to start that?
To be very realistic and practical, if you separate private versus public, let's talk about the private sector hospitals, because I can give my own example. So, when we started, it will be very difficult for a corporate private hospital to set aside funds for research purpose only, because there is not much of a return of investment into there. So how do the clinicians who are interested in research start a research department? Ours was one of the few hospitals in Eastern India to have a departments of academics and research, when there was a separate department. And what we approached the management, that we would self fund ourselves, in the sense that these academic meetings that we do, these lunchtime meetings, and lot of these meetings that we organize, many industry comes and gives us lunches and dinners. We say you don't have to give all that. The hospital will provide, and hospital is happy, to provide these things to the delegates, but give us fund for our research. And what the hospital administration has to agree is to leave aside that fund and let the department do research on that fund. So I think that is where, in a private hospital, in order to start a research department, it will be very difficult to get a separate fund. So generate your own fund. And I think in India, we have a very good opportunities of generating reasonable funds from our own efforts, because a lot of industries come to us for a lot of meetings. From there, we can generate our own. And what the second thing that what we did was, the industry initiated research. So we took part into that, and whatever money came out, they gave reasonably handsome amount of money for per patient included into the research. We put it that back into investigated initiated research. So take part into industry initiated research, but you have to convince your administration that the money which comes out from that has to be given to the department where they can have their own research. So having generating your own research fund, generating industry initiated research, and having a research registrar. We have a research registrar, full timer, who looks into all this. And the department can run many courses, small courses, that will also help them. We have like pharmacovigilance course and other research courses. So those people who come and join, they can collect data for the research in the hospital. So I think collecting data becomes very important. Who has time to collect data? So if you have parallel courses like 9 months course or a year course, and there are 10, 12 candidates coming for those courses, and each one is given some topic. From that, they can collect data from the hospital. They can have their own thesis, but with that data, you can do your research in the department. So I think those are the ways we have been doing research in our hospital.
I think
Oh,
that was a very useful, practical experience message for the crowd listening and whoever wants to set up an hospital by their department. I think to begin with, definitely it's something which is not burdening the hospital. You create your own
mm.
financial stability, and then once it goes forward, definitely, as rightly pointed out, hospitals do come forward. Thank you very so much, sir. I think that ends our podcast for the day. Thank you for your time, and we'll explain facts and answers.
Thank you. Thank you, Dr. Jacob. Thank you, Dr. Monalisa. Thanks a lot.